Hello, my name is Robert Brill. I'm a doctoral candidate in health psychology, and this is my Fibromyalgia podcast series. Today I'd like to discuss exercise with fibromyalgia, lupus, or arthritis. Exercise plays a critical role in wellness. When you're afflicted with fibro, lupus, or arthritis, or multiple sclerosis, you may already be well on your way to becoming physically deconditioned. Deconditioning presents numerous problems, but can essentially be reversed with a simple fitness plan. It's suggested that you discuss exercising with your physician, but most physicians will tell you that exercise is important even with chronic illness. Exercise essentially becomes a powerful treatment modality for otherwise difficult to treat diseases. Deconditioning, or disuse atrophy, is the weakening, fatiguing, and potentially damaging of muscles, joints, and surrounding tissues as a result of being sedentary. Muscles are required to be used in order to continue working properly, but our cardiovascular system needs to be exercised as well so that complications involving the heart, lungs, and vascular system do not increase. Our goal as a person with a chronic illness is not that different from a physically healthy person, which is to maintain health through the maintenance of muscle integrity and circulation. Joints rely on muscle integrity and tone as well to avoid the calcification of bones, so when you don't use it, you actually do lose it. With an illness like fibro, often you face post-exertional malaise and fatigue, which subsequently can increase when you exercise. A large majority of those of us with illnesses like fibro are capable of some form of exercise. When done correctly, exercise benefits every part of the body. It builds and maintains muscle integrity and tone, and it supports and stabilizes joints, reduces fatigue, and increases movement. It's suggested that you do not exercise if you're in the middle of a flare because it might exacerbate your pain or fatigue or actually be dangerous. Being overly achy and fatigued may be the right time to pass on exercise. Personally, I train 4 to 5 days a week as rigorously as possible, and I may take 2 days off a week for recovery. So this program is not that different from a healthy person. The exceptions are that I work out with less weight, less intensity, and shorter duration. But I'm seeing differences in my general pain and fatigue levels as well. Additionally, while my body weight is reducing, I'm seeing some muscle definition breaking through, which is nice. So stopping or reducing your exercise because you're in a flare is really up to you. It's also suggested that exercising while deconditioned or after time off from a flare can cause an injury or extra pain. In this case, maybe cardio like biking or the elliptical are okay for times like these. In fact, when I began exercising, after a long period away from it, I did cardio only about 2 minutes a day for about 2 months to prepare for more rigorous workouts in the future, and I slowly built that up. Plus, my re-entry into the fitness arena was really a slow go since my pain was high and my recovery time was very slow. This way, I only had to deal with minor recovery versus full-out bodybuilder type recovery. Since lupus, MS, arthritis, or fibro, but not fibro, are autoimmune disorders, exercise can be difficult and sometimes you have to walk a fine line with that exercise. Exercise involving strength training, it results in the release of autoantigens, nucleic acid, and other proteins that can negatively impact your immune system and actually cause an increase in your symptoms, so you have to be careful. This is a double-edged sword with exercise and autoimmune illnesses. In general, it may be best to participate in aerobic conditioning when you have a chronic illness like fibro or lupus. This type of exercise is low impact and may be all you're capable of, and will likely not exacerbate your symptoms as much as, let's say, isometric strength training. But your exercise tolerance will increase, even with chronic illness. Don't overdo it. You need to know your body and your specific pattern of symptoms to know how much is too much and when the timing is right or wrong to exercise. Healthy people typically exercise without pain if done correctly. But with chronic illness, you can expect some pain during and after exercise. If you're having an inflamed joint issue, don't work that area out because it's going to exacerbate it. You have to work within your limitations, but don't give up when the going gets tough. My advice is to participate in as aggressive of a routine as you can and settle for aerobic exercises or cardio only when your symptoms are too bad. Exercise will provide invisible results too, like reducing the risk of heart disease and depression, example. Remember, exercising is a coping strategy. to combat illness and is great medicine. Plus, nothing feels as good as fit looks. Thank you.